like to thank you ladies for coming and joining me today. I'm Crystal. I am an RN at Northwest Florida State College, and I'm going to be speaking to you today about the participation of health and wellness programs and their effect on hypertension. Of course, most patients have heard of medical terms such as high blood pressure or hypertension, so we like to think, but that's not all patients that completely understand. Do they really understand and know the importance of keeping it within a safe range? As healthcare professionals, it's our responsibility to explain and educate the patients about the significance of keeping it within the normal limits. As we know, blood pressure is a measure of how hard the blood pushes against the walls of the arteries as it circulates throughout the body. Although it's normal for blood pressure to fluctuate up and down throughout the day, it's not normal for individuals to function at a higher level on a regular basis. As we know, a target blood pressure should be 120 over 80. But hypertension, well, pre-hypertension is actually defined as blood pressure which ranges from 120 over 80 to 140 over 90. When it's in this range, it's basically the body's way of warning you and telling you that blood pressure is trending up and certain measures should be taken to try to reduce it. If left untreated, these levels can progressively increase. When it reaches 140 or over 90 or above, it's considered hypertension. The individual's blood pressure should be rechecked on separate occasions to confirm this diagnosis of hypertension. Typically, it's taken on 3 separate occasions to verify that these are not random events of hypertension or an isolated elevation. The issue with high blood pressure is that someone could function with elevated pressures for an extended period of time with absolutely no symptoms at all. Well, I say no symptoms, however, there are symptoms that are existing that we may not be aware of when the blood pressure could actually be harming the body or causing damage. This is why it's often been called the silent killer, because it usually doesn't show symptoms when it is causing this damage. Due to the continuous pressure on the arterial walls, high blood pressure can lead to the damage of vital organs such as the kidneys, the brain, or the heart. Potentially, these issues can lead to even more serious conditions such as coronary artery disease, kidney disease, liver failure, or even death. Through the use of health and wellness programs, which focus on health and promotion, it plays an important role in positions at patients at risk for hypertension. Research has shown that 1 out of 3 adults are being affected by high blood pressure in the U.S., and many of the conditions are undiagnosed. When conditions such as these arise, not only is there an increase in costs involved for the employers in expenses such as hospital stays, emergency room visits, and other medical costs, but even more importantly, the employee's life is being placed at risk. Through use of health and wellness programs, health promotion is initiated through comprehensive health reviews. Although these programs are designed to decrease the risk in patients with moderate to high risk of hypertension, it also assists individuals with low risk who may struggle with the normal progression of hypertension. Current participation in wellness programs gives individuals an opportunity to identify these risk factors. As educators, this provides us an opportunity to provide useful information which could lead to adjustments in current behaviors which could be contributing to the elevated blood pressure. Continued use of the facilities such as these could truly prove beneficial in diagnosing and treating the condition prior to escalation to vascular disease. Several modifiable risk factors that can be detected through the comprehensive health review include obesity, smoking, and also diet and exercise. Ultimately, these changes could affect a sustainable and beneficial change in lifestyle modifications. Studies have shown that through educational interventions and early diagnosis offered through wellness centers, awareness on topics such as physical activity and dietary measures may assist in the decrease of blood pressure in individuals. According to the CDC, controlling the blood pressure with medications is one of the most effective methods for reducing premature cardiovascular morbidity. This is difficult to achieve without a confirmed diagnosis. This is why it's so important that we initiate comprehensive health reviews, and why it plays such an important role with the individuals. Research performed by the CDC also verified that a 12 to 13 point reduction in blood pressure could reduce the number of heart attacks by 21%, a decrease in strokes by 37%, and a decrease in the death rate from other cardiovascular disease by 25%. Also, from a financial standpoint, it's important to be aware of economic costs involved with the lack of management of high blood pressure. Economic costs due to hypertension in the U.S. amounted to over $70 billion. Of this amount, $272 billion was due to the cost of direct medical expenses, some of which could have been prevented with proper screenings. Again, with the involvement of individuals in the health and wellness programs, people stand a much higher chance of identifying hypertension and preventing the progression of the disease. As healthcare professionals, I ask that you be an advocate for the patient and encourage participation in these programs with an ultimate goal of maintaining blood pressure within normal limits. And that concludes my presentation. Do you have any questions about anything? Thank you again for your time and coming in.